The UCLA Center for Health Policy Research report finds diabetes is the nation's fastest growing disease and is one of the most costly. Here in San Diego County, additional hospital costs for patients with diabetes is $120 million a year extra. Dr. Athena Zimikas with Scripps Whittier Diabetes Institute joins me with more on the local impact of this disease. And Dr. Zimikas, welcome.
Thank you.
Now, this report finds 1 in 3 hospitalized patients in California has diabetes, and that cost is about $2,000 more for a patient that has diabetes as opposed to somebody who doesn't, who's hospitalized. How is it that a diabetic patient might cost more during their hospital stay?
We know that blood sugars that are out of control can cause increased infections, or healing might not heal as well if you are having an amputation, let's say, or really any other chest being open for a heart bypass. So all those things can contribute to a longer length of stay. Longer length of stay translates into higher costs.
Type 2 diabetes rates in California, the report says, has jumped by 35% in the last decade. What is type 2 diabetes, and how is it different from other types of diabetes?
So this really is a skyrocketing epidemic, and it's type 2 diabetes in particular is when the blood sugar rises because insulin is not produced as much as we would like from the pancreas, from the beta cells in the pancreas, and the muscles and other organs in our body are resistant to the effects of insulin and can't take up the blood sugar the way they are supposed to store it, and that results in higher blood sugars.
And there's type 1 diabetes, but that's genetic. You inherit that, correct?
They are both genetic, actually. You have to have the genes for either one. But type 1 is when you destroy all the beta cells in your body related to antibodies that you create.
How do you prevent diabetes, and how is it managed typically?
So probably controlling weight is the best way to prevent and control diabetes. We know that if people could lose 7 to 10% of their body weight, come closer to their ideal body weight, that would probably prevent the onset of diabetes, or at least manage it and stabilize it in a better fashion.
Well, I know this report, the UCLA study, actually found that there was a discrepancy among different ethnicities in the hospitals, that 27% of the hospitalized patients with diabetes were white, whereas it was higher in Latinos and other ethnicities. Which ethnicities are higher at risk?
Definitely Latino is higher, African American is higher, American Indian, and Asian Americans also. We see this very practically in our hospitals at Scripps. We have a rate of 21% up in Encinitas at our hospital, but in Chula Vista, closest to the border, high Latino population there, 40% incidence of diabetes in our hospitals there.
And again, this talks back to the genetic predisposition, then that might be passed along genetically. Another interesting finding was that Imperial County actually leads the state of all the counties looked at with the most diabetics patients hospitalized. 41% they found, compared to, as I said, about 29% in San Diego County. Why would a particular region have more diabetic patients?
Right. It probably is related to the higher Latino population in Imperial County. Higher age also contributes to the development of diabetes. As we all get older, you're at higher risk. So both of those things can be a factor. If you don't have a lot of exercise, that also contributes.
No, you've read the study. What policy recommendations would you like to see happen that maybe come out of this study?
Oh, I would love to see more focus on education. That's where you can really tell the public what is going on, what they need to do to prevent it, and really some practical information, both on how to identify it early, what to do if it's identified early, so that they can prevent those hospitalizations that they found in this study.
And there is no cure, correct? You just manage it once you get it, or can you reverse it?
You can reverse it. I'm not sure I would call it a cure, but certainly well-managed diabetes results in very few complications. So whether it's through lifestyle changes, weight loss, or through all these wonderful medications that we now have available to us, any of those should be used well to really bring you down to ideal blood glucose values.
If you're watching this and you're concerned that you or a family member has diabetes, what should you do, or might be heading in that direction, what should you do?
Contact your physician is really the best way. Easy screening approaches through blood tests, and then connect with some education programs. Your physician has access to those no matter which health system you're with, and that really is the best approach.
All right, Dr. Athena Zimikas, thank you so much.
Thank you.